Well, thank you everyone for being here. I really appreciate it. I'm going to talk today about TMJ, and this is just the initial slide I had up for people to read when you got here. And you can see people with jaw problems, all the different stuff that this can be connected with. And so as I talk to you, by the time you leave here today, you're going to have some idea why all this is connected with it. And by the time you leave here, you're probably going to be saying, wow, I didn't know there was that much stuff going on with the jaw. So you'll know more about the jaw than the majority of people in town when you leave here today. I am a chiropractor, and so I do general chiropractic, family chiropractic, but over the years I've done a lot to help people with jaw problems, and so I've been focusing on that more lately is helping people with jaw problems. And so I'm a member of the TMJA, which is the TMJ Association, and I go to tmj.org, and that's where this first selection of slides are going to come from. And the TMJA is an organization, they're patient advocates, and they're out there to get a greater understanding of TMJ problems and related disorders and treatments that will help and not harm the patient. So what can we do to help people and not harm them? So it's important to get people the help that they need. And November is TMJ Awareness Month, which is why I decided to do this talk in November. The TMJ here says sometimes the TMJ patient just needs inspiration just to get through the day. So sometimes for some people it's pretty tough. Some people it's pretty simple clicking, a little bit of irritation. Some people it gets up to 8, 9, 10 on the pain scale for them, and it gets pretty difficult to deal with. And right now they're estimating that 10 to 35 million Americans have problems with the TMJ joint. And TMJ, as we know, just stands for the temporomandibular joint, which is the jaw. And so saying TMJ is kind of the same as saying knee. Just because you have a knee doesn't mean you have a problem with your knee, right? So we refer to it usually as TMJ disorder, but kind of generic term is just TMJ. The association is saying, less is often better. So to be more conservative for care rather than getting in and doing something invasive. And so I'll go through these slides. These are all from the TMJ Association, but I want you to see up there 85% of patients with TMJ also suffer other conditions, so pain conditions in other parts of the body. So their jaw's bothering, but maybe it's also their neck and their shoulders, and I'm going to explain soon why that's also interrelated. There's also comorbidities, so that means kind of a co-problem. You don't just have a jaw problem, you also have a neck problem. They're involved with TMJ because they occur together more often than by chance. Who is affected? Like I said, 10 to 35 million people in the United States, and the majority of them are women in their childbearing ages, and also women who are taking hormonal supplements, which could be birth control or just general hormonal supplements, tends to create more problems. And the current thinking right now is that 70% of teenagers are suffering from TMJ issues. 70% of teenagers with TMJ issues. And I'm not real sure why that might be, but it could be with what's going on. And here's just an example. We bring these kids into school, and for 12 years they sit like that. And we kind of wonder, well, why is there neck problems? Why are people suffering headaches? Why are people suffering jaw problems? And we're looking right at it. So what causes TMJ disorders? Well, there's a whole selection of things that happen. I mean, it can be just a direct injury to the jaw. Maybe someone fell down, maybe someone got hit. And this can play a big role, especially when it happens in childhood before the body completely develops. There can be a jaw problem, and then their jaw grows incorrectly or their jaw grows out of balance. Dental procedures, I've had people come in, they'd just been to their dentist a couple days sooner, they had their mouth open wide for so long, and so then they're still having some pain. It just kind of makes sense on that. Anytime someone overextends their jaw, and then also here, people who have bruxism, which is grinding of the teeth and grinding of the jaw. And a lot of times people don't even know that, and they'll go to their dentist, and the dentist will say, oh, it looks like you grind your teeth, and the patient doesn't even realize that that's what they're doing. Symptoms can be as simple as hearing a little bit of cracking, hearing a little bit of popping, to having pain in the jaw, pain in the neck and the shoulders, chronic headaches. So I'm here to talk about jaw problems, but they're not really isolated. A lot of times they go hand in hand, and that's that comorbid thing. Stiff jaw muscles, limited movement, or even locking of the jaw, ear pain, pressure and fullness and ringing in the ears because of jaw problems, grating and noise in the jaw, bite that feels off. Some people have dizziness and even as bad as vision problems. Diagnosis, well, how do we go about diagnosing what's going on? Well, that's kind of the doctor's job, is to get to these classes, get the education, know how to look at things, and then figure it out. And getting the correct diagnosis is important so you can get the correct treatment. This one just talks about comorbidities, and again, that's other things that goes along, and again, this is just from that website. But people can have a condition called ankylosing spondylitis. They're more prone to these problems. Asthma, head, neck, and back pain, chronic fatigue. Ehlers-Danlos syndrome, that's issues with the strength of the tendons and the ligaments. And so knowing that, the doctor needs to know that before they start working with people. So those are all things for the doctor to talk to the patient about, and that's what we call, the exam and the questions at the front end. So I want you to think about this one. I told you I'm a chiropractor, so I love finding stuff like this. And this is all medical stuff. And they're saying, according to the National Institute of Health, they have a brochure on TMJ, it strongly recommends using the most conservative, reversible treatments possible. Conservative treatments do not invade the tissues of the face, jaw, joint, or involve surgery. So who can help you without stabbing a knife or a needle in there? Who treats these disorders? Medical doctors, chiropractors, and the dental community work with sinus and make sure people don't have sinus infections. It's important to know that the teeth are in good health. If people are having headaches, if they're having neurological disorders, they're important to know. So advertisements portray TMJ as a simple click and pop that can easily be fixed. TMJ is often trivialized by the dental and medical communities as an insignificant problem. And this one goes under the heading of a stigma. And so there's frustration on the patient's part, and there's frustration on the doctor's part, because the doctor wants to help patients when they come in. And sometimes as a doctor, when someone comes in and needs help and we can't figure it out, we get frustrated. If we're helping them and they're not getting better, we get frustrated because we feel like we owe the patient the ability to help them. And the patient gets frustrated because they've been to 8 different doctors, they've all done different things, and they haven't helped them. And so now they're standing there going, oh, who's going to help me, and what do I do? Do I got to go to one more person? Is this person going to help me? So there's that stigma with it, and there's that frustration with it. And it's nice to know that you're going to someone that can help you, or at least know who else can help you. This again is from the TMJ Association. They say injections and surgery come with disappointment and high rate of failure. The patient is often left in more pain than prior to the treatments, which none of us want. Believe me, the doctors don't want patients getting worse either. I did some of this in red and I can't read it here. Oh, this just talks about insurance coverage. It's also a little bit of an issue. The dental insurance doesn't cover jaw issues, and health insurance is a bit of a struggle sometimes to cover jaw issues. Fortunately, when I look at people, a lot of times they have neck problems with it, and so insurances help with that. So it's on a case-by-case, individual basis on how that will all work for you. So the next part of my presentation is how do we know what we're working with? You have to know what you're working with. So I want to talk about the joint specifically. And so in your body, we have joints that are ball and socket joints. And if you look at someone's hip, it looks like there's a ball there and it's going in a socket. Just like the receiver hitch on your pickup or your SUV. And it's just a round ball, and then the socket goes right over the top. And the great thing about this is you go down the road and you turn, the trailer turns, and this whole unit works well. It can go side to side. If you hit a dip, it's going to move. Everything's going to move real nice. And the hip will do that. The hip will move all these directions, and the shoulders do that really well. but they work individually. The jaw basically is a ball and socket joint side by side. So there you have the ball on the top, and then up there you have the socket. Anyone know what that little hole is right next to the jaw? That's the ear canal. And so if you see, there's not a whole lot of space between there. So people with jaw problems, there's a lot of nerves, there's arteries, veins, a lot of soft tissue in that area. And so the jaw can be problematic and help plug the ear and cause hearing problems and ear problems. That's why that earlier slide, it said stuffiness of the ears and ringing in the ears. Also, as that jaw slides back, the windpipe is there, and that can cause issues with breathing, especially when people lay down to go sleep at night. So having that aligned and working correctly is important. So this top part here is on top. Think of maximum. We call that the maxilla. And the bottom part there is the jaw. Another name for the jaw is the mandible. This here is a temporalis bone. That's the temple right there. So they call that the tempomandibular joint. Now on the jaw there, remember the ball and socket? And so this one here, we have the ball on each side. So these can't move really all that independently. They're locked in together. So if you get smacked over here, it affects the other side as well. The other thing is, I told you it was a ball and socket, but when you look at it, it really doesn't look like a ball, does it? If it does look like a ball, it looks like a football. And so that's more of a football shape going up into that joint. And as the mouth opens, the pressure slides over and back up. It slides over and back up as that jaw opens and closes. So you remember this part up here is a temple, and that actually connects down here to the jaw. So there's the jaw joint, and on the jaw there, they call that the coronoid process, and that temporal muscle sits right there, and that's what helps to initiate closing the jaw. And so when people come in with headaches and I start working in that temporal area, there's a lot of tightness, and a lot of times that'll go down into the jaw. And so next time you chew food, put your fingers up by your temple and you open and close your mouth, and you'll feel that moving up there. The one that we all think of for closing your mouth, of course, is the next one. And that's a muscle that goes from the bottom of the jaw there right up to there. And that's what gives you the strength to really close that mouth. And that's what really gives you the strength to chew. And that's just another picture of the same thing. And then that's the cheek muscle. And that's the one that you bite on accidentally sometimes. All right, the front of the neck, we have a series of muscles. That's just looking straight at someone. But this is looking at the side, and right from the center of our chin here, we have a muscle that comes down right here by our voice box, because we have a bone up front called the hyoid bone. And then that actually comes back by the ear there as well. So that's this thing, it comes down and it goes up by the ear. And so that's really important in helping to open your mouth. Well, some people with jaw problems, that doesn't work well, or the muscles are really tight, and so we need to work with those to get all that working correctly again. And then here, if you'd be looking up under someone's chin forward, you can see the muscles back there, and those are all important with opening and closing your mouth. These pictures here are pretty cool because this shows you the jaw there where it says condyle, that's the top of the jaw, and then you have the disc, and then you have the socket of the joint up there, and then you see some muscles that are attached to that. So what are those muscles doing? So let's talk a little bit about muscle or jaw movement. And this is, I picked up at Target, this is a little skull for Halloween. And when I open the jaw, it just rotates like that, right? And that's what we all think the jaw does. We all think the jaw rotates like that. And so these two muscles up there, they're attached to the disc and they're attached to the jaw. So I'm going to play you a short video here, and I'm going to explain to you and show you how this jaw actually works. So it'll just take me a minute to work my magic here. So this is the part that's going to make you go, wow, I did not know that. Or I'm just really a nerd and get excited about dumb things, which is partly true probably. So right here, I'm just going to turn, we decided that, should we try that? Okay. So here's the jawbone going up to the top, and then that lavender thing there, that's a disc. So remember I talked about the ball and socket? Well, it's a ball and socket with a piece of felt that's greased in there, to help that move around. And so this is going to be really cool. And these are these two little muscles I showed you. I didn't tell you what they were. They're called the pterygoid muscle, and just like pterodactyl, the dinosaur that had those huge wings, well, whoever looked at this thought that it looked like wings. I'd probably name this something else if we're up to me. But that's the disc up there, the lavender thing, and behind it is called the retrodiscal tissue. And so the disc doesn't have any pain receptors, so it doesn't feel pain, and it doesn't have much for blood flow coming in. But the part back there can be very painful. And so we're going to watch and see how a normal jaw opens and closes. And remember, we talked about this thing. It just rotates, right? We're thinking, oh, that jaw just rotates. That's the way I would have made it, but. So we're going to watch that jaw. See how that opens and closes? So what happens is, you see that this muscle is attached to the bone. And that muscle there is attached to the disc. And then the disc is attached with the retrodiscal tissue to the back, to the bone. And when you open your mouth, you're just rotating. Well, your mouth will only rotate so much, and then it slides out. And that's called the transition phase. And the job of that muscle is to pull that disc and keep it on top of that bone, and that bone comes ahead, and that protects that joint and allows it to function the way it should. While that's pulling that disc ahead, that muscle is shortening up, and that's what's helping to pull your jaw forward and transition and slide out and down, and it gets that little bump there. So imagine there's a spasm in those muscles, or imagine those muscles aren't working like they should. Should be playing again. Oh. So there you just see it opening and closing. So that's pretty cool. How many of you knew that that's the way it worked? Just me? Okay. Well, that's why I'm here. That's all right. So now you see this enlargement. You see that ball, and then you see that lavender disc, and then you see the other part of the joint, the socket part. And you see those muscles sitting there. So now those muscles relax. That temporalis muscle helps to pull it back up. And there they're just showing you, they call this the articular disc. And that just serving as a good cushion, and it's keeping things from wearing out as we open and close. And so there, that's normal. And there you go, they call them the pterygoid muscles. So it's a little slower, but I kind of like it. It's nice to see this a few times. That bump I told you, that's called the articular eminence that it's on. And that's really nice. That's what you want. This next part is what you don't want. So see how that disc slides forward? And now that jaw is pushing on that white tissue, which we know has pain receptors in it, and we know that that's supposed to be holding it. It's not made out of the same material as the disc. So now that slips forward and the person's having a lot of pain up there. And you see how that muscle is so lax, it's not working like it should. And now you see it pop, right? And then when it goes back, it pops again. Pop. Pop. So then we sit there and do that, and then you wonder why when you close your mouth, that jaw hurts. Who's this new to? And did anyone know that this is the way the jaw worked? Pretty cool, isn't it? So it was worth coming tonight, huh? At least when you go home, you look at people and go, I know more about the jaw than you do. Yeah.
So can you fix that?
Well, I suppose. So sometimes as well, sometimes it doesn't go out of place like that, but that disc gets a little gristly and thick, and people will get popping because of that, and they'll get jaw pain. And then when it happens to this, the question is, well, can that be fixed under conservative care? And can I do that? And the answer is I can treat it, and the likelihood of that getting better is significantly high. And so if you take your finger there and just kind of poke right under your cheekbone there, and you come over here, you're going to feel that big muscle, and that's your masseter muscle. If you just poke along that bone there and go forward just a little bit and push in there, that's pushing on these muscles right there. If you push way back in there, you can get at those a little bit. So when someone comes in with jaw problems, that's one of the areas that I work the muscles on the side of the face, work those muscles out under here, get those muscles worked out, the pterygoids, and then and get that jaw adjusted and get the neck adjusted. So I'm going to stop this here, and I'm going to go back to the PowerPoint. Hopefully, okay, my girl's up there, so. So just to still, I guess I already showed that well enough, but that's a normal jaw, and those two muscles pull that ahead, and this comes out of that joint and comes forward into there. And then that's when the mouth is fully open. And some people have had that mouth stuck open, and those have to be adjusted and pulled down to get put back in where they belong. And this one here, this is the abnormal. This is what we don't want. We don't want that ball and socket, and we don't want that retrodiscal tissue pinched between there, because that's going to hurt. That's like pinching your finger in the car door. And we don't want it popping and sliding there. So, this is probably the best part of the whole talk. There you go. Pass those down. Don't give that lady. Oh, you're going to give her one? She didn't give it back this morning, so I'll have to find someone else. I'll get you one. You ever seen these before? Yeah, this is like an old people thing, maybe, but they're kind of cool. So on this one here, no, you got to have one. Hand that over down to her. So when you look at this, if someone's head is where it needs to be, so I'm going to be talking about the balance of the body now and what this has to do with the jaw. So if you have someone there standing with their ear above their shoulder above their waist above their knees above their ankles, that's the way the body's made to carry itself, and it doesn't give you a lot of weight and stress. If you pull your head at 15 degrees, you got a 27-pound increase in your head. So I have a heavy ball at my office, and I'll have people hold it like this. And you can hold it there all day. You bring it out like that, you're not going to hold it as long. And you bring it out like that, you're probably going to be lucky if you can hold that 2-3 minutes. Well, we're doing that to ourselves all day. And so the further we go ahead, the more pounds we're adding and the more weight we're adding. Well, what's that got to do with this? So as you look at this, our muscles should be working straight and at angles. And when you see when we add the stress, just look how much stress that adds to the body. And the other thing you'll notice here is her chin suddenly starting to pop out. So as I go forward, my eyes want to see, so this is what happens. Is this normal? So imagine all the stress that's adding to the neck, up to the neck, and into the jaw. And this picture was just to show someone how bad posture looks in the neck. I don't think they intended to do this, but look at his face. As he's jetting out, you can just see his jaw coming out and tightening up. So imagine what that's like doing that all day. And it doesn't even have to be that drastic. So imagine if you push on the bottom, it should only loosen up the legs, right? But look what it's doing to the neck. And so see how your whole body, this is just knocking the ankles loose. So your ankles keep your knees in place, so your knees keep your hips in place, your hip keeps your low back in place. So whenever I adjust someone with low back pain, I always adjust their knees and their ankles because that's what's holding it up. So when you're working with someone with their jaw, it's not just their jaw. You have to make sure everything else is working correctly. And I really like this picture because it shows how all these muscles from down here are going up to the neck, which is working with the jaw. And remember that stuff under the chin I told you about? That's all working with the jaw and the mouth and all that opening up. And then this one here really shows how, if you look up there by the ear and below the ear there, you have muscles on both sides coming forward and backward, and you have to balance that. And if you don't balance your muscles, you're going to have that problem. And so that all has to be looked at. So to diagnose someone, we have to know what's going on. And so x-rays can help us a lot, but x-rays show us the bone. And we can look at the joint up there, which I'm not tall enough to reach. I don't know if I can connect enough of these. But if you follow this line straight up, that's that jawbone that I was telling you about, the ball and socket. And you follow that one up. Those are the jaw condyles. And you can look at those on an x-ray, and they look rounded. It looks to me at the end that there's fairly white on both sides. So on x-ray, you can kind of tell if there's some wear and tear on there, which is going to really indicate if there's something wrong. And you can do some measurements on there so you can get a good idea what's going on with the bone structure. And here's a picture from the side. So I can look at pictures either, from the medical doctor's x-rays or from the dental x-rays. And this one, it's tucked up in there a little bit, but if you follow this straight up, you can see that joint there. So we can look at those. And that can give us a good understanding of the bone. And remember when I said that, if someone's injured during childhood, that bone up there might not grow the way it's supposed to. And you can tell that by looking at this. And so it gives you a good indication of what's going on. But if we really want to know what's going on with the disc, an x-ray is not going to show that. We need to step up and do an MRI. And so the MRI, that's that condyle, that ball that I was talking about, and there's the socket. And so we need to do MRIs. And so here's one that's going to be a little labeled for you. And as you look at that one, you can see the condyle, and then the red arrows are pointing to that white line, and that's the articular disc. And then the radiologist can look at that, and he can tell you that that's of the right width, and if it's pushing on the retrodiscal space or if it's pushing on the disc, and that's what we can tell. And more importantly, they can look at it and tell you if there's even a disc there or if it's been destroyed. And if it's been destroyed, then you're probably looking at other care and treatment other than just going to the chiropractor. However, I have had people in my office and I just looked at them and said, I cannot help you. And they looked at me and said, well, you have to help me. There's no one else for me to go to. And so I adjusted them and they felt a whole lot better. And so is it worth it to that patient to feel better? Well, that's what they're really concerned about. Did we kick the can down the road? I'm not sure. The patient hasn't come back. She was happy and I hadn't seen her again. Just this last week, I was talking to a patient. She came in for her upper back, and she said, hey, remember when I was in a year ago, and I told you my jaw hurt? And I said, yeah, or my jaw hurt and was popping? I said, yeah. She goes, that's been almost a whole year. And she said, just yesterday it started bothering me. I said, you want me to get your jaw too? So I just did a simple adjustment to her jaw, and she goes, oh, it stopped popping. So some things are that simple, and then some things can get complex. But this is just back to picture of the jaw again, because we just looked at the MRI. So there's that disc up there in blue, there's those muscles, but that's kind of what you were looking at in the MRI, was the condyle bone, and you had the socket up there, and in between there the disc. Okay? So now that you know all this stuff, what are you going to do? And so I have been doing a lot of extra studying on the jaw stuff. I've been a chiropractor for 16 years, and I've been helping people with jaw problems the whole time. But I've heard so many people come in and they go, well, they just don't know what to do with their jaw problems. Some of the dentists in town will work on them. They'll give them bite blocks and everything. Well, it's kind of helping, but it's not doing enough. So I end up doing some stuff for them while I'm often trying to read and find stuff. This is just something for the average person to learn how to work with your own jaw pain, but I still read it. There's tons of literature online, and sometimes it gets frustrating for me because I even work with other professionals and go, well, there's no evidence that this works or that works. And I was like, well, have you looked? I mean, there's just so much. I don't think I could ever read just what's out there on the jaw. But this one just says effectiveness of thrust manipulation of the cervical spine for temporal mandibular disorder. So they studied just adjusting the neck to help the jaw. And this one here is a book. This is written by a medical doctor, and I have to order his next book, which is twice as big as this. All he talks about is the TMJ and other stuff related to the jaw. And I just happened to be online, and you know what it's like if you're looking for tires for your car, and the next time you go on Facebook, every third or fourth thing is something about car tires. Well, when nerds go on Facebook and look up TMJ stuff, then stuff like this starts popping up. This doctor is a dentist. Why is he showing people pictures of the neck? This dentist says, if you want to help someone's jaw issues, you got to help their neck issues. Everyone knows this, but who's going to do it? And this is a picture out of that TMJ book I showed you. And that's the very top bone. The red one is the very top bone on the neck, and your head sits on top of that. And that's right behind your ear and your jaw. And what he's showing on this page and talking to us about, if that neck is out of alignment, and as a chiropractor, this guy's a medical doctor, and he's showing me chiropractic stuff. And as a chiropractor, this is what we do. We look at the neck, and we look at these bones, and we figure out what's out of alignment, and we push them back where they belong, so that way the body can heal correctly like it's supposed to. It gets its balance back. These muscles can do what they're supposed to do. And so he's just showing when these are out of place, the muscles that are attached to it is going to start pulling everything off a kilter, and guess what's going to happen? And so it's kind of simple mechanics as far as that goes. This was done by a bunch of researchers back at the turn of the last century. They figured this out. They used to call it the Lovett brothers because they were brothers to each other, but now they call it the Lovett-reactor relationship. But you'll see they show that the very first vertebrae, C1, is directly related to L5. So they're saying you can't keep one in place if you don't keep this in place. They're related. They tested thousands of people and they figured out what was going on. And they're saying you can't work on L4 or C2 unless you're working on them together. So sometimes people might go, why are you working on my neck for my jaw? That doesn't seem related. But it's really crazy you want to work on my low back. But also remember what I said. If your ankles and your knees aren't aligned, then your low back's going to be out. This is my wife's idea. This is a pretty good tool, isn't it? Yeah, she's a smart one in the family. So, so you do not have to suffer. There's help. And really the easiest cheapest, most conservative way to go would be to get over to my office, start getting an assessment, and try to figure out what's going on and get you under some care. And like I said, I've been adjusting for 16 years, and I've seen some really great stuff for people with these jaw problems. I do a lot of extra training on the TMJ stuff. This year alone, I did a 2-hour course. I just finished up a 3-hour course, which was specific to jaw adjusting. And starting in January, I'm going to do an 8-hour course, and it's through a neurological program. And it's people that teach neurology, and they're talking about how the jaw affects everything. And so it's going to be pretty intense. I'm actually a little bit nervous about it because it's kind of like going back to school and really having to hit the books. But as doctors, the more we understand what's going on, the more we can look at people and figure out what to do. So I think I put my name on top because I think this would be a really good place to start. Obviously, it's also a good idea to know what's going on with the teeth. So with dentists and the orthodontists, physical therapy helps immensely to get muscles strengthened up correctly. So things that will help outside of what I'm doing, of course, would be braces. Some people do well with a mouth guard, and some of the dentists will know that the jaw is uneven, and they'll build up a night guard that you can bite on that keeps one side higher or lower than the other to try to level those things out. And I think I'd really like to see patients have those and get chiropractic care too and get physical therapy because those things all work together. People can get jaw injections. You know, people will go in and get injections of steroids and pain relievers to try to get that thing to relax. There's something called prolotherapy. That's where they'll take a needle in and put it in the jaw muscles, and it actually kind of dissects or pulls that muscle away a little bit, and it causes a healing reaction. And then kind of last choice for me anyhow, I'm not against surgery, but surgery is good for people that aren't me. So I always would, and I've had surgery before, but it's something I'd prefer to put off, especially in this area. And I put number 1 fat graft because some of the people I'm working with and communicating with online with TMJ stuff is a dental group, and they're claiming just the absolute best thing that's going on for someone who's truly lost their disc or their disc is shot. They remove what's left, and they'll actually put a fat graft in there. So they'll take some fat from the hip, and they'll squish it down, and they'll stick it in the jaw, and that'll replace that padding in there, and that'll allow that bone to not wear out so fast. Because as soon as that bone is wore out, the bone's gone, right? And so then you probably don't have a whole lot of choices to deal with things. Some people I've read about arthroscopy is a good idea, and some people think it's a terrible idea. And so arthroscopy, they stick a scope in there, and then they can visually watch on TV what's going on and see what's going on inside of that joint. I wouldn't be against it so much. I just think sometimes our expectations are a little off. I don't think arthroscopy is probably going to heal that disc, but you can go in there and get all that tissue out of there that's causing problems. But again, now it's bone on bone, and you'll end up needing a fat graft anyhow. And that's, I think, why this one group just says that just do it. That's what you do. That's their standard. And then last thing on there is a joint replacement. They go in and they actually cut that ball off and they actually ream that socket out, and then they put metal or plastic in there. But again, that's such an intricate little area to work at. It's really hard to get that precise. Obviously, I'm sure there's exceptional surgeons out there, and so it's getting the right doctor. So that's basically the end of my talk. My main goal was basically to educate you, get you to understand what's going on with the jaw, and just to get you to understand that there are some simple conservative things that can actually help a lot of people. But kind of what I tell a lot of people, kind of what my mission is you don't have to suffer with a lot of this stuff. Like, I see a lot of people come in with headaches. And I had a guy come in, and his wife's been trying to get him in for over 8 years. And I don't know what she did, but he finally listened to her. And he came in 3 visits, and I asked him, how are the headaches? He goes, well, I haven't had one since I started coming in. And so why suffer in pain when you don't have to? You know, there's hope out there. Anyone have any questions?
You hear sometimes where have to break your jaw, and I don't know if that's through dentistry or that there's some procedure they got to do where they pick your jaw.
Yeah, and I'm not real sure. Some of you don't know I used to work in surgery before as a chiropractor. I was a guy that handed instruments to the surgeons. And so I think what they mean by breaking the jaw is you'll get the oromaxillofacial surgeon, like Dr. Kimbler. And what they'll do is they'll open the mouth up, they'll cut through the gums, and they'll take a saw and cut it. And then they'll either set the jaw forward or back.
Okay.
You know, I used to always picture as a kid, they'd hire some big guy to come in there and wham, break that jaw. And breaking a jaw, to me, just sounds like so haphazard. Let's see what happens. So I think that's probably what people are talking about. I think sometimes that jaw can get fused and they might have to manually get in there and force that to keep working. Yeah. Is there a question over here?
I don't think so. I know she has trouble with her jaw, and the dentist, the doctor, no one has helped.
Yeah.
When it's to the point, what to do,
Yeah.
So.
Well, questions are free today. So what did you think of the talk? Did you understand the jaw a little better? Okay. Does it make sense? Is your jaw feeling tight? Okay. And then does it hurt to open it? Okay. So what have the dentist done for you, the doctor?
Nothing. We did go to the chiropractor. I think he had said it was more so her muscles.
Yeah.
Isn't that what he said? It was her muscles? And it helped for just a bit, but then, she'll open her mouth, it gets stuck.
Sure.
Painful, so.
And this is kind of tough for people to take. It's also tough for me to take, is because it's really cool when someone comes in for 3 visits and they're better, and then I'm going, I'm so good. But the truth is some people, okay, so I explained it this morning. A stitch in time saves 9, right? And so I tell people, well, sometimes a crack in time saves 9. So when someone comes into my office today and says, I was out scooping snow, I just threw my back out. A lot of times I can fix them in 1 treatment. If they wait 2-3 months, it's probably going to be 3 or 4 treatments. If their back's been hurting them 5 years and they come in and say, crack me, and we're like, come on, seriously? You think I'm going to fix you in 1? And I think as chiropractors, I think sometimes we get a little full of ourselves and we think we should fix everyone in 3. And I'll tell you, I had a lady years ago, she taught me a lesson, and I've learned a lot from my patients. And she was in my office over 20 times for neck problems. And it was frequently, and we set it up. And I sat her down, I said, I just got to be honest with you, I don't think I'm helping you. I said, I'm happy to keep helping you, but I don't want to keep wasting your time and your money. And she looked at me and said, you have to help me, no one else can. And so that was 20. The 25th treatment, 24th, she didn't feel any better. 25th treatment, she came in and she goes, I'm like 10, 15% better. It's like she looked like a different person. She was happy. And I think I did another 5 to 8 treatments on her, and I see her every year or 2. She goes, yeah, it's starting to hurt again. And so I'll adjust her, and then she comes back when she's ready. So with headaches, with jaw, what I tell people is, well, the body doesn't just get fixed sometimes in 1 or 2 treatments, and I don't know how many it's going to be. And I'm not out there to try to get you in for 50 treatments. I respect people, I respect their time, but I want to help people as fast as I can, as much as I can, and get people out taking care of themselves and having their own life. That's really what I want to do. And I also have to be honest, it doesn't do you any good to adjust you 3 times and say, well, I can't help you. You wasted your time. And so what I like to do with people is get them in 2 to 3 times a week, kind of depending where they're at. Sometimes there's a feeling out process to see how that person gets better. But come in 2 to 3 times a week, really put the effort into it for 3 or 4 weeks, really get this thing loosened up, really get those muscles working, because I'm adjusting things manually. I'm manually putting things back into place, but also the nervous system is getting used to what's going on. And I used to tell people it's kind of like your kid sitting on the couch and you go, hey, would you take out the garbage? And they just lay there. You ask them 10 times, all of a sudden you yell at them and they go, well, geez, you don't have to yell. And then you go to your kid, well, if you'd have listened the first time. And so it just takes the body, you got to keep telling it, and then suddenly, finally, it starts to listen. And so I get a lot of feedback from my patients every visit to find out where they're at. And I don't want to let people go too quick and then they fall back in that trap again. And if someone has significant problems for a long time, I just really got to be honest with you, it's going to be a series of treatments. I doubt you're going to be done in 10, but I'm thinking somewhere between 10 and 15 or 10 and 20, you're going to be going, oh wow, now I can see the difference. And braces don't work overnight, you're in them for months. And so it's getting in there as a chiropractor, figuring out what's wrong, getting it adjusted, getting those muscles coordinated and firing correctly, and then at the right time have the patient start doing some exercises so that way their muscles want to keep everything where it belongs as well.
So there's a lot of issues with tinnitus or the ringing of the ears.
Yes.
Tinnitus.
Yeah.
And kind of sounds like that might go hand in hand a little bit.
It goes a lot with it, and that causes fullness and the ringing. And this guy here, this was a little frustrating to buy the book because there's a lot of information in there, but the doctor's from Korea, and he has his own franchise of how to help. So the book tells you all the problems, but just a little bit about the solution, and he sells his own device, but he doesn't let you buy the device unless you go to school with him, and I don't know that I'm going to be going to Korea anytime soon. But I've still gleaned enough information, and what I know about adjusting people, it's starting to make sense. But one of his big claims is that he can help tremendously with the ringing in the ears, yes. But there's a couple different pathways of ringing in the ears. Some of it's actually the muscle feedback, and some of it can be nerve damage. I don't remember the antibiotic, but our age group used to give an antibiotic that would have actually damaged the nerves to the ears and cause the ringing. If that's what it is, you're kind of out of luck. But if it's muscular or skeletal, you're good. So I used to have a real bad problem with ringing in my ears. I went to chiropractic school and I got adjusted 3-4 times a week because we're always practicing on each other. And one day I noticed, wow, it's gone. And it was gone for over like a year and a half. Well, then when I got done with school, all of a sudden one day it started again. And it was so freaky because I hadn't heard it for so long. So I think mine had a lot to do with my neck and with the muscles. Yeah.
So a lot of times when you're adjusting people's necks, that kind of corrects things with the jaw.
Absolutely can, yes. Mm-hmm.
Without even realizing that you had it.
Right, and like that dentist there, I mean, and some people are just, this paper here, just said all they did was adjusted the neck, and they helped jaw problems go away, yes. And two, just so you know, some people are kind of afraid of chiropractors because of the image that we have. They think we're going to just run across the room and jump on them. Some people kind of think that, and I'll do it. But most cases, it's either manual and it's really gentle on the neck. And for some people, at first, it's a little scary. I've had some people been really scared, and after a few treatments, they really realize how much it's helping them, and they're really good with it. I have this spring-loaded instrument for adjusting, and what I'll have the patient do is they'll lie down, and I'll put my fingers on their jaw, and they open and they close, and I can tell that this jaw is moving ahead and the other side is sliding back. So it's a unit. And then so what I do is I have them open their mouth, and I adjust this side back and this side forward. That's the most simple adjustment I do. And then usually one's a little higher than the other, so the high one I push down. And that's just taking this instrument, putting it on the jaw, and popping that. So it can be just that simple. Do you want me to try it on your hand? So this is how terrible it is. Pretty bad, huh? Yeah. So this is called Activator. It's just a spring-loaded adjusting instrument. Yep. Any other questions? I'm happy to answer them. Okay, what did you have done? Did you have your neck adjusted and stuff?
He adjusted everything. She had never been to a chiropractor before.
Yeah.
And so we thought we would try it, and she did feel better because she also suffers from headaches.
Yeah.
And I think everything was out.
Sure.
Her back,
Yeah.
jaw.
And remember those pictures of that student sitting in school. And I'm happy to tell people what I do, but I'll be sitting there in my office and I'll be farting around on Facebook, and I swear all of a sudden I'll notice I'm doing this. And I'm the older generation with some discipline, and I'm telling you, I'll sit there like this, and my chin is literally on my chest, and I'm going, what are you doing? And I'll literally have a headache, and I'll literally feel like crud, and my ears will be ringing, and I do it, yeah. And so I'm not so much picking on wanting to be on Facebook or whatever, but it's just like that is just so detrimental. And I do a talk also on headaches and posture. And a lot of the times when people are having headaches when they're doing this, that neck is so stretched out and back, and those nerves are stretched out, and it irritates the nerve there, and people get headaches, and they'll swear they have a golf ball behind their eye. And I just love it when people come tell me that, because that's such an easy fix. It can be. But again, some people, 2 or 3 treatments, that's not fair. I mean, the patient deserves better than that. It takes more treatments. So who wants to keep their giraffe? Okay. I was going to keep them. So I got a kind of a trivia question for you. I'm also a dad. If you guys don't know that, I have 2 daughters. And I'm probably like the worst dad at dad jokes and saying dumb stuff to my kids, to the point that they don't really trust when I tell them something for real. So we were on a trip, and when we go on trips, I'd always try to educate them, or we'd talk about stuff, or if we were going somewhere, we'd try to know something. But I knew we were going to a museum, and I knew that they had skeletons of different animals there. And so I asked them, I said, how many bones does a human have in their neck? Anyone know? Mark, how many bones in the human neck? How about you folks over there? I'm also an auctioneer. Anyone bid a 5, 5, 6, 6, 6, now 7? You guys know? 27. There's 7 bones in the human neck. 7 bones. How many are in a giraffe's neck?
A lot.
How many?
7.
Oh, she's a
I would
smarty
say
pants.
60 or something like that.
Okay. What do you guys think? How many bones in a giraffe's neck?
Same as a human.
Why would you say that? So this is like way out there for you guys, but biology lesson. But all mammals have the same number of bones. Some of them have some missing, but a whale has 7 bones in its neck. A gorilla has 7 bones in its neck, and a giraffe has 7 bones in its neck. They're just really tall. And yep, can you imagine being my daughters thinking, no, dad's full of malarkey? So this is the beauty of it. We walk into the museum. I'm not even kidding you. We walk in 10 feet. I turn to the very first room, and there's a skeleton of a giraffe neck. And I look to my oldest, and I go, hey, honey. I said, look at the giraffe's neck. What do you think of it? I said, what do you think of those bones? And she goes, well, they're kind of long. I said, count them. Dad. And she's gone. So the only thing worse than your dad picking on you is your dad being right about something dumb. So there's 7 bones, and that's why I really like these. If you count them, there's 1, 2, 3, 4, 5, 6, 7 bones in that giraffe's neck.
So it's atomically correct, huh?
It is. I don't know about the rest of it. I don't know if that tail's right. All righty. Anything from you guys for questions? Any answers?